How's the royal family? I pray that everyone is doing well. Well, my royal family, I'm doing a second video, as y'all can see, about this crack pipe issue. All right? And I said that it doesn't matter if it's the Democratic Party or the Republican Party in regards to this particular issue. They are giving out misinformation. Anybody that's new to the True Royal family or my backup channel, True Royal, I do deep research. Do I always get it right? No, I don't. And one of my subscribers, me and her had a little bit of a back and forth. We were both respectful towards each other. And I try my best to provide links. I don't always remember, but I try my best. And I did some more research. So I said, well, I'm going to do research even more because maybe somewhere I missed the mark. Well, my royal family, True Royal, did the deepest research I have ever done. And I got a bonus. Anytime I say I got a bonus, lean all up in it. And I'm going to show y'all further what this is all about. So as usual, I have videos and articles and different things like that. So you need to go get your shit. I didn't get my shit today. I just didn't. I'll get my shit later after the fact when I watch the premiere. All right, my royal family, so lean all up in it. I have stalled enough, but you should always have your shit on deck if you new to the True Royal family. So let's start here. Okay. I pray that y'all can clearly see this. Hormone reduction supplies. Safer injection kits. Safer smoking supplies. Crack and meth pipes. Okay, we ain't gonna get into all the sexual stuff. So in order to see that visually, that lets you know that that is true, my royal family, that the government have been distributing what they call smoking kits. One for crack and one for meth. I didn't even know there was even a damn difference. I know about the crack, but I didn't know about the meth. And there are many folks feeling some kind of way all about this. So what I'm going to do first is I got a little bit of something to read, and then I'm going to present a video. So Fox 4. Several media outlets reported the Biden administration planned to distribute clean crack pipes to individuals addicted to drugs and underserving communities after the Department of Health and Human Service announced grant program towards substance abuse and overdose prevention. All right. However, the grant document did not specifically say it will distribute crack pipes, leading some to believe media outlets twisted the truth. Listen to me, damn it. These people be lying to us. All right? So, the program would include funding for harm reduction initiatives such as safe smoking kits supplies, according to the Substance Abuse Mental Health Service Administration. And I put the link in there. All right? See here. Fox News published in an article Tuesday that this program grant will supply underserving communities with syringes and crack pipes. However, nowhere in the grant the grant document does it specifically specify the distribution of these devices, or does it indicate the supplies are directed towards minority communities? So keep that on your frontal lobe. When they showed anything, they was showing in them kits alcohol swabs, lip balms, other materials to promote hygiene and to reduce the transmission of diseases like HIV, hepatitis. All right. When you start hearing that other, let me go back up in here on this article. I didn't read it all. I just read the juicy parts. Let me see here. Yeah, let me go back right here. Several media outlets reported that the Biden administration planned to distribute clean crack pipes to individual addicts to drugs in underserving communities. Okay? Pay attention to serving communities. That is saying, when you read in between the lines, that they've been putting this out. You see what they have here. This, what I put up here, and let me go back further because I made a slight mistake here. Let me, because I'm reading off of, I work off of two computers. It just helps me because I'm so damn dyslexic. Let me pull up something here that really struck me. Let me see how I'm gonna find this. Okay, kits. And let me see here. Let me click on something. In fact, what I'm gonna have to do, because I'm gonna go ahead and play this video, and it's something further that I want to show the royal families in regards to this particular website. So let me back up. Not go that way. Let me go the other way. Let me back up here and show y'all how long this program been around. That's what I want to put. So that is the Northern let me see here. Northern Health region. All right. And let me see if I can get that pulled up for the royal family. Oh yeah, I found it. It's something I'm gonna show y'all that literally knocked me down when I okay, let me see here. Let me bring this up. Let me hit this link. Because when I found what I found in this program, they literally was giving education on how to use the pipes. And there's so much damn information out here. That's why we have bloggers, because we don't want to clutter you and you'll start reading surface shit and then you don't know, what's what at the end of the day, because they're going to lie to you. They're going to lie to you and keep you in a state of confusion because they're trying to make things look a certain way. So I think I have found it. But what I'm going to do is I'm going to play this video as I continue to do my research. Hopefully I can find what I had when I was doing my deep research to point something out to you in regards to this particular clinic. So my royal family, we're going to get into, let me switch over. We're going to get into this first video. And then I have something else to read y'all down the road. Okay. Let's take the volume up as far as possible. This video is a little over 7 minutes. pay attention to language. Pay attention to what is said and what is not said. And I'm also going to point it out, but I'll let it flow.
Dr. Jason Johnson is back with me, and also joining the conversation is Cassandra Frederick, the Executive Director at the Drug Policy Alliance. Cassandra, let's begin with you and set the record straight. Is President Biden handing out free crack pipes?
What this federal funding is focused on is giving money to harm reduction organizations that are giving public health instruments to folks in communities. And really, this is historic in nature because we've been dealing with the overdose crisis for so long, and the federal government has not invested in the public health infrastructure that we need. So this is really about giving resources to overburden under-resourced nonprofits that are working with people who use drugs to get access to resources that we know will lower the incidence of drug use, we know will connect people to treatment and housing and food supplies, and we also know works to reduce the likelihood of people overdosing, which we have just hit 100,000 people.
Yeah, and I thank you, first of all, for clearing that up, because I think that's such an important point while you have other outlets and networks drumming up all this misinformation and lies, because the subtext here, which we really know what it is the federal government is giving free drugs to Black and brown folks. Which brings me to you, Jason. Honestly, why all the outrage over the alleged free crack pipes, but not so much when it comes to things like Narcan and things that help, address opioid use and whatnot?
Because crack is always associated with lowbrow Black people, and even Black people have perpetuated that. Whitney said crack is whack. Chappelle used to say sprinkle some crack on it. We joke about it within the community. So the idea of being a crackhead or a basehead has all sorts of negative connotations, not just with white America, but with sort of respectability Black America.
Yeah.
It's a very, very, very terrible attack. But here's what I think is more important. It speaks to the underlying issues that the Biden-Harris administration has with trust in the Black community.
Yeah.
Because there are stories that you would hear if you told me tomorrow that they were handing out free cell phones, right? You remember the Republicans tried to say free Obama cell phones? Nobody believed that.
Yeah.
Obama's not going to give you a free phone. So part of this is people still have certain distrust issues with this administration in the Black community. That needs to be addressed as well.
I agree with you. And Cassandra, you were actually somewhat critical of the Biden administration for what you saw as backtracking because responding to some of this right-wing outrage on the plan to provide comprehensive, safer smoking supplies, calling it a missed opportunity. If you had the ear of this president, let's pretend he watches Cross Connection every Saturday morning, what would you say to him?
I would say to what I said before, which is make sure that health policy is dictated by evidence and science and not clickbait. And I think we have to have a conversation about framing. I think the way that the White House framed it made us susceptible to the right wing and drug warriors to really push forward this really racialized response. We are very clear. We're clear. We know what's happening. They're using Black people and our health as a political football. It's the same thing they're doing in education with teaching kids about racism and slavery. It's the same thing they're doing about us with people who use drugs. And the last thing I will say is it is not a coincidence that we're having this conversation when overdose is going up dramatically among Black Americans. When even in this conversation about stimulants like cocaine and crack, that is where we're seeing such a high growth rate in overdose deaths, and now is this huge falsified outrage, even after Republicans have ceded, 3 days before, Representative Tom Cotton came out in support of syringes and harm reduction and said we should look at supervised injection facilities, and then the next 3 days later, he's talking about crack pipes. This is a ploy, and it's really dangerous, and it's important for our community to be clear about what we need to keep our families safe.
Yeah, absolutely. And, Jason, there was a study that examined the disparities in drug use. And listen, the arrest records and drug convictions nationwide over the past 30 years, you and I grew up during the fake war on drugs, during the years of Just Say No. When Dave Chappelle made that point, when you look at opioid use, just say no. What's so hard about that?
Not really
now we have all the empathy in the world for people. One thing that I think needs to be addressed in this, the government absolutely has some accountability to address the crack epidemic, given that they themselves were a kingpin, according to some reporting, particularly out of the San Jose Mercury News. The government used drugs to fund an illegal war in Central America by selling it to the Black community, according to reporting, according to hearings on Capitol Hill. I kind of feel like, yeah, this is your responsibility.
It's not only responsibility, but also it's the cultural perception of responsibility, right?
Yeah.
There's a reason that, 10 years apart, we have shows like Snowfall, which makes it very clear what the government was doing. And then we also have Breaking Bad, where it's like, oh, we feel sorry that a suburban white family has to sell drugs in order to pay their bills. So the government, you have elected officials who view drug use in the same way. Look, people who are using drugs, they are suffering. They need to be helped. It is to the benefit of all of us to help people who have drug addictions. And I don't care what color they are. But when the help is framed in racist context, when certain people are seen as victims and other people are seen as irresponsible, that is where the government has a role to play. That's where the Biden administration has to step up. And I also want to say this because we talked about it. This is also where internal African-American media has to be careful in how these stories get framed. There was a lot of conversations back and forth.
Let's talk about it. Call them out. I know what you're talking about.
We're talking about BNC, but again, Aisha Mills, our friend, went and spoke and said, hey, look, we can't shed this information on our network. Black Enterprise did it. The Shade Room did it. We have to be careful internally to not spread the same nonsense and misinformation. Mistakes happen, but you got to own it and you got to move forward.
And this is no shade to the Shade Room, but a lot of people get information from the Shade Room, and so we want to make sure that they don't adopt the conservative talking points, because I like to see Black people who believe enough in Black people to not believe the things that they say about us, which is, centuries in the making. So Shade Room, if you ever need some input, like, we are your people, call us. We can always fact check for you. So thank you so much for this important conversation. I hope this clarified for folks who are interested in being informed what this whole crack pipe story was all about. Thank you, Jason Johnson and Cassandra Frederick.
All right, my royal family, let me go back here. Basically, these coons, they know what's going on.
Dr. Jason Johnson is back.
And I want y'all to listen to the very beginning of this charade game. Charades, damn it, my royal family. So, listen. She asked a specific question of this sister. And what did she say? Or what did not say?
Me, and also joining the conversation is Cassandra Frederick, the executive director at the Drug Policy Alliance. Cassandra, let's begin with you and set the record straight. Is President Biden handing out free crack pipes?
What this federal funding is focused on is giving money to harm reduction organizations that are giving public health instruments to folks in communities. And really, this is historic in nature because we've been dealing with the overdose crisis for so long, and the federal government has not invested in the public health infrastructure that we need. So this is really about giving resources to overburden, under-resourced nonprofits that are working with people who use drugs to get access to resources that we know will lower the incidence of drug use, we know will connect people to treatment and housing and food supplies, and we also know works to reduce the likelihood of people overdosing, which we have just hit 100,000 people.
Yeah, and I thank you, first of all, for clearing that up, because I think that's such an important point.
Let me stop right here, my royal family. Now, when she asked her a direct question, we already know her title, so she knows the ins and outs, all right? When she asked her a direct question, all she had to do is say yes or no. She didn't have to go on and on and on and on and on. She part of the rhetoric. All right. We clearly see here typical safe smoking kit. Glass, pipes, and stems. Who want to argue with me? At the end of the day, wherever the story lands, it lands, my royal family. So what is being said and what is not being said? Yeah, I'm speaking loud right now because I feel some kind of way. And I'm not tripping off of the response. I'm not tripping off of the response that anybody in the royal family gave me. No, I invite that. I love that. But did you see what you see? And even when I looked at the kit, the bullshit that they showed on there, you could tell something was missing. Okay? Typical safe smoking kit. glass pipes and stems. I ain't reading the other shit. Typical kits. You got to pay attention to the language. You got to pay attention to the visual that they are presenting to the royal family. All right, my royal family. I'm going to take this all the way down. All right. And we're going to go real deep. I found something last night. This audio that you're going to hear, April 8th, 2021. All right? Just listen.
And Arundel stops distribution of crack pipes aimed at slowing overdoses in Annapolis after Black community backlash. Admitting they hadn't put enough thought into handing out clean crack pipes to slow overdoses and disease spread among drug users in Annapolis, the Anne Arundel County Health Department responded to backlash in the Black community and said it would stop immediately. The glass pipes were brought to the attention of community leaders by an Eastport Terrace resident, a recovering crack user who has been clean for 17 years, said Carl Snowden, a longtime civil rights activist and convener of the Caucus of African American Leaders. Distributing pipes could have unintended consequences of tempting former drug users to relapse, said Snowden, who recommended the practice be stopped immediately. Dr. Nilesh Kalyanaraman, county health officer, confirmed in an email to members of the caucus on Wednesday that the pipes came from AA Power, a group affiliated with the health department that distributes supplies aimed at reducing the potential for harm among people suffering from substance use. It started distributing the glass pipes this week. Honestly, we didn't put enough thought into the cultural implications of this, Kalyanaraman said Thursday. It was more focused technically on harm reduction, and we didn't take the broader picture into as much consideration as we should have. That's why we are pulling back on that piece of it. The community is in support of the other pieces of it, and we're going to continue with those. Crack first appeared in the United States in the early 1980s. It was cheaper and easier to manufacture than powdered cocaine, which allowed it to spread rapidly throughout the country. Its introduction would eventually be described as an epidemic as it drastically increased both the number of Americans addicted to the drug and subsequent hospital visits for cocaine-related emergencies, according to a history of the period published by the U.S. Department of Justice. The impact of the drug was particularly hard on Black families living in overcrowded, poor neighborhoods, resulting in high rates of addiction and incarceration. AA Power was established 18 months ago to provide education and supplies such as fentanyl test strips and naloxone, an overdose reversal drug. It also connects people with drug treatment and mental health services. In the last 5 months, organizers began to hand out sterile syringes and other drug administration supplies to prevent the spread of disease. Those kits will continue to be distributed. This week was the first time it handed out the pipes, which could be used to smoke crack, as well as meth and fentanyl, Kalyanaraman said. The county spent $3,842 on 16 unassembled pipe kits, a box containing 100 each, and another $2,408 for 500 pre-assembled pipes, according to department data. Alderman Dewan Gay, D. Ward 6, has been asking for programs aimed at reducing overdoses in the city for more than a year. He applauded news that they were finally reaching the community because radical approaches are needed to stem the tide of overdoses since the pandemic began. But, he said, I do understand the concern. Crack cocaine has not been kind to our community. Harsh federal anti-drug laws created what was known as the 100-to-1 sentencing disparity between crack and powder cocaine starting in the 1980s. Possession of 5 grams of crack mandated the same minimum sentence as 500 grams of cocaine. For decades, Young black men were the ones most often arrested on charges related to crack and received harsher penalties than white people caught with powder cocaine. The 2010 Fair Sentencing Act reduced the sentencing disparity to 18-1, but the damage had already been done. As of 2012, 88% of crack cocaine offenders were black, according to a U.S. Department of Justice report. Memories of that time stick with Kevin Simmons, Annapolis Office of Emergency Management Director. He recalled the disastrous effect the drug had on black communities. Simmons said there were no discussions of distributing glass pipes to Annapolis residents when his department and health officials met last fall to discuss adding syringes to supply kits. Simmons said when he heard that residents had received pipes, he didn't believe it. "That's nothing I can get behind," Simmons said. "I've seen AA power in and around the city, mainly in Ward 6, and they seem like they do a very, very good job. It's just that they had this one glitch with the crack pipe, and it was a lack of communication." Distributing crack pipes is a terrible idea because they are considered drug paraphernalia and thus perpetuating a criminal act, said James Spearman, a retired Annapolis police sergeant and member of the Caucus of African American Leaders. "I think we're much better served with trying to dissuade people from using crack and trying to get them into treatment and trying to steer them to a positive path," Spearman said. "I understand the use of syringes when it comes to intravenous drug use because you can slow the spread of HIV and things of that nature, so there is a public health issue that's being addressed." Kelly Annerman said there are health benefits to distributing the pipes, namely slowing the spread of hepatitis C among users. Pipes made from plastic can cut or burn a person's lip and leave behind trace amounts of blood that spreads the disease between users. Reducing the sharing of drug supplies can help prevent the spread of COVID-19, he said. Harm reduction has become an increasingly widespread and effective tool against the opioid epidemic. In 2019, the Maryland Department of Health established the Center for Harm Reduction Services to oversee the state's resources like its syringe and naloxone distribution. There are currently 16 state-approved syringe services programs in Maryland, according to the Maryland Department of Health. Some of those do offer safe smoking kits, including Baltimore Harm Reduction Coalition. Thanks to a boost in funding in July, the group began giving out glass pipes and copper wool for use as a filter. The additional supplies were received with jubilation from some Baltimore residents, said Harriet Smith, the coalition's Director of Education and Acting Director of Services. There was a similar reaction when the coalition began offering safe sniffing kits, which include straws and a blank ID card that can be used as a clean surface as opposed to surfaces in public, Smith said. "Folks really don't want to have to find things on the ground or search out the tools that they might need," she said. "Honestly, they don't want to have to share because they know the risks of doing so. And so they're extremely thankful to receive services beyond the sort of typical syringe distribution that has happened in Baltimore for so long."
All right, let me stop that. Take that all the way down. Well, before I take that down, again, April 8th, 2021. So they've been doing this. Now, if y'all continue to pay attention to me, I said pay attention to language, what is being said and not being said. Now, I was going to show the royal family this particular, they call them the Northern Health Region. When I was on their website and I couldn't find it, you got to realize when we're doing a lot of research, it becomes like a clutter. And they were literally showing how to safely use a crack pipe and a meth pipe. They literally were showing it. And whenever I find it, because I know I'm going to have to put up another video about this issue, I will, my royal family. I pray that y'all are listening to me. Now, I got something to read to y'all. to show you how real this shit is and how they continue to try to spread misinformation. Because based on that article that was just read to y'all, there were a number of our folks felt some kind of way. These pipes being given out, and these smoking kits given out. They've been giving them out. And I said, when I was reading that article, that communities that are underserved were not receiving this. What else they were not receiving in underserved communities? Pay attention to language. Damn. Now, in the Hill, Rubio and Mitchell offer bill to prevent feds from buying crack pipes. They introduced, all right. This article came out February 11th, 2022. On Friday, a bipartisan bill. Wow, these people, they put up a bill to show you how real this shit is at blocking federal funds from going towards crack pipes and other drug paraphernalia. Okay, I don't have to read the whole damn article, my royal family. They trying to prevent something that the Democratic Party said was never there. So why would they go that fucking far? Think about what I'm saying. Do your own thinking. All right? I'm not trying to insult anyone. I'm just a bit irritated with the media. I'm not irritated with my folk. All right, I'm going to leave that right there. Now, as I'm doing my research, things pop up, my royal family. And I have said to folks behind the scenes, some of your news, you need to go overseas. Now, I didn't try to go overseas. Overseas came to me. Check this out. Check this shit out. The Irish Times. All right? HSE hands out almost 50,000 crack pipes in 5 years. Okay, they distribute this, the risk of hepatitis C and other shit. So let's listen.
Almost 50,000 crack pipes handed out by HSE over last 5 years. The HSE has purchased and distributed almost 50,000 crack pipes since 2016, as the number of people using the drug in Ireland continues to rise. Health Services began distributing crack pipes several years ago as part of the government's harm reduction strategy outlined in the National Drug and Alcohol Strategy. The sterile glass pipes are distributed by the HSE and local drug treatment agencies to prevent crack cocaine users from engaging in risky behaviors such as sharing pipes or making their own. Like needle sharing, sharing of crack pipes increases the risk of disease transmission, particularly hepatitis C. According to figures released to the Irish Times, the HSE Addiction Service has purchased and distributed 49,021 pipes since 2016 at a cost of €65,000 or €1.30 per pipe. These were distributed in Dublin, Limerick and Galway, where the rate of crack use has been a matter of increasing concern. The figure does not include pipes distributed by local drug agencies. In 2016, 3,414 crack pipes were distributed to users. By 2020 this had risen to 12,882, a 277% increase. This is in contrast to the number of sterile needles distributed by the HSE for heroin use, which has remained broadly stable in recent years. Since 2016, it has distributed just under 3 million needles at a cost of about €800,000, the figures show. As well as preventing the spread of disease, distributing sterile drug paraphernalia is an effective way of reaching drug users and offering them appropriate treatment, said Dr. Eamon Keenan, the National Clinical Lead for the HSE, Addiction Services. Although sterile needle distribution continues to dwarf the distribution of crack pipes, recent evidence suggests the crack problem has been worsening dramatically. The number of people treated for crack cocaine use increased by 44% between 2018 and 2019, according to the report from the Health Research Board, HRB, released last July. It called the increase a worrying trend. Crack is a smokable form of cocaine which produces a much stronger but shorter-lasting high than its parent drug. This is typically followed by an intense craving for more, and addiction can set in rapidly. It is typically smoked in a glass pipe or a homemade tube made out of a plastic bottle and is usually much cheaper than cocaine, retailing for as little as €15 a dose. The increase in the use of crack is likely linked to the increased availability of cocaine, from which it is made. Garda sources say cocaine use in Ireland in recent years has surpassed Celtic Tiger levels. The Garda National Drugs and Organised Crime Bureau seized a record amount of drugs in 2020, including 209 kilograms of cocaine, valued at €14.6 million. The number of people being treated for cocaine addiction has tripled since 2013.
Okay. So, even though that article came to me from overseas, what it is deeper telling me in America. See, these people, I don't care if that's over there in Ireland. These people travel throughout the United States. Look how COVID has touched the entire globe. So, there has been a crackdown in America on opiates. I have shared with y'all that I live in chronic pain. And you would not believe the hoops that I have had to jump to show that I'm truly in chronic pain. Even though you see it all in my records, I didn't have numerous surgeries and all that stuff. All right. So they make it really hard. You know, you got to really show that you live in chronic pain. So since they're cracking down, and then also with Rona in these streets and stuff, it is getting harder and harder to get opiates. And addicts gonna do what addicts are going to do. All right. And in that article, it further showed you that in the white community, because if it's going on in Ireland, it's over here in America. So somebody in the black community said, oh, damn, y'all making sure y'all folks is getting syringes and whatever you need to get your high on. And then one day they seen some crack and meth pipes being distributed. That's how it had to reach the black community, because I just showed y'all, played that other audio where black folks was upset that that these kits were being put out because of it's being stereotyped that black folks disproportionately, other than any race on the planet, use crack. That's not true. Drugs don't discriminate. You go in one of them damn crack houses, you'd be surprised who you see in there. You see all kind of folks and all kind of races. I know what I'm talking about, my royal family. We all got addicts in the family. All right. There's even people who have gave testimonies that they have been clean and sober. You know, I even had somebody come at me on my backup channel, said, be respectful. When have I been disrespectful to the royal family? When have I been? I know this is a sensitive subject. It's sensitive to me, but I'm going to keep it core. I support programs that prevent spreading diseases. Damn. Now, somebody said to me that it's a trigger when you see this type of stuff. I did not realize that. I did not realize. That is not my end goal or end game to trigger anyone in the royal family. But I'm trying to keep it real as possible, my royal family. That the government lies to us. That's my driving force of all of this. That's why I was showing this. This shit ain't just popped up. They call them smoking kits. All right? Again, safe injection kits, safe smoking supplies. And you see they even give out, because they were saying that, once people get high, they want to have sex. Or some people, got to give up some sex in order to get some drugs. It's terrible. And I know some of these things that I'm saying, some people are not going to hear me whatsoever. All right? And it is what it is. I invite all of that. Bring it to True Royal. Let's be respectful, because I had a back and forth with someone and we were respectful towards each other about all of this. Misinformation from the Democratic Party and the Republican Party. They lie to us. So why should we be bickering back and forth about the enemy and the enemy supporters lying to us? Even our own folk was sitting up there lying. She asked that sister a direct question and she would not answer it directly. And then I did a freeze frame and said what was in them kits. And it clearly pointed it out to you. It is very, very real. So my royal family, what I need you to do is render your voice with your beautiful divine words. And as always, my royal family, I thank you for your love. I thank you for your support. And with that said, Ashe.